I'm Victoria Yacht.
Yes, my first name is Hayes.
My name's Liz.
I am a third-year student at Shenandoah University.
I go to the University of Maryland, Baltimore.
I go to the University of Maryland, Baltimore.
We're between 20 to 40 years old, pretty active, which was a good population to work with. I feel like I am used to working with high school athletes, so this population was a little bit more exciting to work with sometimes.
I feel like I saw like a pretty wide range of patients here. We had a couple of joint replacements, post-ops, to like ACL repairs.
We saw quite a variety of ages. I think youngest around our age, so like 25 all the way up to older adult. They all came from different socioeconomic backgrounds and kind of like work occupation backgrounds too, which is super interesting and super cool to hear about as well.
I would say the clinic itself is just great. Like, I feel like all of the clinicians are very supportive of one another, and that's just an environment that's enjoyable to be around in general. And then on top of that, we have this amazing gym, and having so many resources that I've never had in a clinic, I learned a lot of different exercises and interventions that we can do. So that was pretty exciting as well.
This was my first PT experience where it was a true 101 patient care setup, and I really enjoyed it because the previous clinics I've both been a student at and worked at were all one patient every 30 minutes. The therapist is seeing like multiple patients in an hour, and I think this experiencing like a setting like this really just opened my eyes to like what therapy can be and what it really should be to like provide the best care possible.
I like that the treatment time was one-on-one. That's like really nice to help see the actual progress that you're making with the patient. I also liked the location because I live relatively close, or my commute was relatively easy. I think about took like 5 minutes. Emily was really great as well. She's super knowledgeable, and all the other clinicians were very friendly and knowledgeable too. So if she was busy, approaching them was quite easy as well.
Oh, she is just like an incredible clinician. She's so knowledgeable about everything. She's really good at challenging me to be confident in what I say instead of being like, oh, should we do this? She's like, I don't know, what do you want to do? And I just think that she has such a good background in sports that she translates well into patient care every day. I really respect her as a clinician, and I really enjoy that she brings evidence-based practice into everything that we do as well.
Nahal, oh Nahal, I think he's a very fun CI to be with. He just really creates a work environment where I feel like you're able to be yourself. But I thought it was super fascinating for me to learn about just like the science behind plyometrics, because that's definitely something that we are never taught in school. And that's what Nahal has been doing. So I really appreciated like him teaching me what he's been learning for himself.
Well, I really appreciate she was a kind of a recent graduate from my program, so we had a lot in common to talk about there, and she kind of knew coming in what I was taught and what maybe our program that we came from wasn't as strong in teaching. A ton of exercises that Emily would suggest and show and demonstrate to patients that I haven't really heard of before, which were really good. A lot of cool lower body exercises because Emily was like a really good soccer player. So
Okay, so my favorite part about working down here is the wide range of people that we see. We had patients that worked with the government, we had patients that use like only transportation services, we had like lower income, higher income, and I think that was cool just to see like such a wide range. Really nice to get that, and like I felt honestly like I was making more of a difference here than anywhere else.
How relatable you're able to connect with a lot of patients, because most of our patients live like within walking distance. So it almost creates like a sense of like a small community. Like sometimes I feel like I'm not even like treating patients, but I'm just treating like a neighbor that I like got close with.
definitely being super close to the Inner Harbor, kind of when the weather starts to get nicer, everything starts to bloom, and taking walks.